Hi, everyone. Welcome to Opportunities to Help Mitigate the Hunger Cliff with Healthcare and Economic Security Programs, hosted by FRAC. I'm Steve Hayward, FRAC's Senior Communications Coordinator. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captions are available. To enable captions, click the CC button in the bottom taskbar. At the end of the webinar, there will be time for questions and answers. To ask a question, please use the Q&A tab. With that, I'll pass it off to Alex Ashbrook from FRAC.
Welcome. Thank you all for joining us today for the Opportunities to Help Mitigate the Hunger Cliff with Healthcare and Economic Security Programs. I'm Alex Ashbrook, Director of Root Causes and Specific Populations at the Food Research and Action Center, aka FRAC. I use she, her pronouns, and I'll be the host of today's webinar. Now, it would be great if you all could introduce yourself in the chat and put an emoji next to your name and organization that captures how you're feeling today. I want to make sure I give credit where credit is due. Since I stole this idea of putting an emoji next to your information from a webinar I attended this week hosted by the Cash War Room working group that the Economic Security Project convenes, and you'll hear more from the Economic Security Project later on. All right, so are we getting any info in the chat? All right. Thank you. So keep that coming, folks. So my hope is that today's webinar leaves you inspired with new ideas and equipped with some actions you can take to help mitigate the hunger cliff that millions of people will face when the SNAP emergency allotments end. First, a word on FRAC. Next slide. FRAC works to improve the nutrition, health, and well-being of people struggling against hunger through advocacy, partnerships, and by advancing bold and equitable policies. Now, as part of our work, we support policies and programs that reduce poverty and other root causes of hunger. Hence, FRAC is delighted to offer this webinar featuring our lineup of all-star presenters. Connecting families with nutrition programs like SNAP, WIC, school meals, summer EBT, congregate meals, home-delivered meals, food banks, and other resources are essential ways that anti-hunger stakeholders can take action to help mitigate the harm to families brought on by these SNAP cuts. But mitigating the harm will also require a multi-sector approach that draws on additional partners and programs, particularly those that address root causes of hunger, like families' access to healthcare or access to economic security. So this is the essential goal of this webinar. It's for you to learn about cross-sector opportunities to address some of the root causes of hunger that can bolster your work to support families as they face the looming hunger cliff. Next slide. Today, we'll hear from three fabulous presenters representing three amazing organizations. Ali Gardner, who's the Senior Research Associate at the Center for Children and Families, followed by Pedro Morillas, Director of State Campaigns, the Economic Security Project. And then our wrap-up hitter will be Sarah Beth Geld, Executive Director of the Southern Economic Advancement Project, also known as SEAP. Now on to the agenda. So this is our opportunities agenda. Today, we'll hear about opportunities anti-hunger stakeholders can partner on to, first of all, ensure families can continue to get Medicaid in the face of the program's unwinding that threatens to strip millions of coverage. The second opportunity is to connect families to the child tax credit and the earned income tax credit and support efforts primarily at the state level to improve these vital credits. And finally, you'll learn of opportunities to leverage American Rescue Plan Act funding, ARPA funding, in your state that may be available to support families struggling to make ends meet. And then we've reserved plenty of time for you to ask questions of our wonderful presenters. So without further ado, I'll turn it over to Allie Gardner.
Thanks so much, Alex. So like she said, I'm Allie Gardner. I work for the Georgetown University Center for Children and Families. And we are a nonpartisan policy and research center founded in 2005 with a mission to support access to high quality, comprehensive, and affordable health coverage for all of America's children and families. And so today we are going to focus, as Alex mentioned, on the unwinding of the continuous enrollment protection, which will start April 1st. Next slide, please. Pardon me. So how did we get into a situation where unwinding is needed? So in March 2020, Congress passed the bipartisan Families First Coronavirus Response Act. The law included federal fiscal relief for states in order to address potential increases in Medicaid enrollment during the pandemic-resulted economic downturn, as well as associated declines in state revenue that were expected from the downturn. The Families First Act temporarily enhanced the Medicaid federal matching rate, or FMAP, by 6.2 percentage points for all states and the territories until the quarter after the federally declared public health emergency ended. While there were 4 maintenance of effort requirements in the Families First Act that states had to abide by to receive this enhanced FMAP, the most notable and our focus was the requirement that states could not disenroll any individual on Medicaid as of March 18th, 2020, except for a few exceptions. This is what we refer to as the continuous enrollment protection or provision. The Families First Act and many of its provisions, including the continuous enrollment protection, were tied to the federally declared public health emergency. Under the law's framework, individuals had to remain covered in Medicaid until the first day of the month after the PHE ends. As a result, states had to maintain stable Medicaid coverage for enrollees throughout the PHE, the first time such a provision has been enacted. Next slide, please. In December 2022, though, Congress passed the Consolidated Appropriations Act, or the Omnibus, which, among other things, delinked the continuous enrollment protection from the PHE and set an end date of March 31st, 2023 for the protection. The CAA also made changes to the enhanced FMAP states received. Previously, the enhanced FMAP stopped at the end of the quarter in which the PHE ended. However, under the CAA, the temporary increase in federal matching dollars will now be extended and phased down throughout 2023. The chart on the right shows the changes and associated phase down of the enhanced FMAP for Medicaid and CHIP, since the increase indirectly applied to CHIP. The Omnibus also established a number of requirements for states, including state compliance with all federal Medicaid renewal requirements and new mandates for updating enrollee contact information and dealing with return mail. There are also new transparency, accountability, and enforcement mechanisms, which will help CMS's oversight of the unwinding process. Next slide, please. So in order for states to receive this enhanced FMAP during the phase down, they must meet a new set of requirements. Currently, states cannot implement eligibility enrollment standards that are more restrictive than existing Medicaid or CHIP standards, nor can they increase premiums. After April 1st, and until the enhanced FMAP is completely phased out, states are still not allowed to establish more restrictive eligibility and enrollment policies, and generally must hold premiums at the same amount. States must also continue to cover testing, vaccines, and treatment for COVID throughout the end of the year. And as discussed on the previous slide, states are also required to comply with all federal requirements for renewals, as well as take steps to update enrollee contact information. As part of the requirement to make efforts to maintain up-to-date contact information, states have to use the USPS National Change of Address database, state human service agency databases, or other reliable data sources to attempt to ensure updated contact information like mailing addresses, phone numbers, and email addresses for enrollees. However, the use of all of these databases is not required. The state just has to use one of these 3. The state is also encouraged to conduct outreach to enrollees, working with MCOs where possible. As part of these efforts, CMS has established temporary Section 1902 E14A waivers, or E14s as we call them, which allow states to implement strategies to smooth the renewal process and promote continuity of coverage. One of these E14 waivers that states can request is partnering with MCOs to update enrollee contact information. Next slide, please. So to set the context for the scale of the unwinding and why it's such a significant enrollment event, here's the most recent data from CMS on current Medicaid enrollment. As you can see, Medicaid enrollment has increased by almost 20 million since February 2020, which was right before the Family First Act's continuous enrollment provision was enacted. Of those currently enrolled, most are covered through Medicaid. And for the 7 million or so children covered through CHIP, the Children's Health Insurance Program, a large portion are actually in a Medicaid expansion CHIP program, or MCHIP. This is where states increase the child income eligibility level and get the CHIP enhanced FMAP, but otherwise Medicaid rules apply. During the unwinding, states will have to complete a renewal for for these tens of millions of individuals enrolled on Medicaid. Next slide, please. So procedural disenrollments is something that we talk a lot about in relation to the unwinding, which occurs when individuals lose coverage for non-eligibility reasons, specifically when additional information is needed to determine ongoing eligibility. This means these individuals are not determined ineligible for Medicaid due to income or another factor, but rather there is an administrative reason they were terminated from coverage. Procedural disenrollments are one of our biggest concerns going into the unwinding. Many people have changed their addresses over the past 3 years. Some have not had to complete a renewal form ever, et cetera. So states that maximize ex parte renewals, or which is also known as automated renewals, will have fewer disenrollments. Ex parte renewals use available data and systems to renew eligibility without requiring paperwork for enrollees. So there's no action steps required for beneficiaries. Historically, many individuals who lose coverage for procedural reasons are actually still eligible for Medicaid coverage, but become uninsured. Procedural disenrollments can occur for a variety of reasons, which are almost always administrative related issues. For example, an enrollee might not receive their renewal form in the mail, or it was never delivered in the first place. Confusion can also contribute to procedural disenrollments, like if the notice an enrollee receives is unclear or not in their preferred language, or if an enrollee is not able to get through to a call center for assistance. As I mentioned earlier, many of those who experience procedural disenrollments will still be eligible for Medicaid and will reapply for coverage. This will lead to additional work for state agencies at a time when staff will likely already be overwhelmed by the unwinding. Additionally, individuals will likely experience gaps in coverage prior to re-enrolling, and both individuals and state agencies will face increased costs from the cost of medical care incurred during gaps in coverage and administrative costs from re-enrolling individuals. Next slide, please. So last fall, the Assistant Secretary for Planning and Evaluation released a report that estimated the projected enrollment effects when the continuous enrollment protection ends. This highlighted the red alarm bells going off in regard to the procedural disenrollments that I talked about. The report found that approximately 15 million individuals are expected to lose coverage when the continuous enrollment protection ends. Of these, 6.8 million are expected to lose coverage despite still being eligible for Medicaid. These charts show which populations are most at risk for procedural disenrollments. The data is quite stark, especially for children. Of the over 5.3 million children expected to lose coverage, over 70% will still be eligible for coverage. Procedural disenrollments will also disproportionately affect people of color, particularly Latinos. Next slide, please. So as states begin to initiate Medicaid renewals over the next few months and begin the unwinding process, there are a number of challenges that exist. First and foremost, states will have an unprecedented volume of renewals and changes in circumstance to process, as I just highlighted. This will be an even bigger challenge for states that have not been conducting renewals over the past few years. Another concern is out-of-date contact information for enrollees as states try to send important notices and renewal forms. Additionally, there may be fiscal or political pressure for states to get through all of their renewals quickly, which can lead to errors as well as periods of untenable workloads for years. Many states also have staffing shortages in eligibility and call centers. For example, a recent survey by the National Association of Medicaid Directors found 1 in 4 Medicaid agencies have a vacancy rate that's over 20%. And for individuals who have never been enrolled in Medicaid prior to March 2020, they may not be familiar with the renewal process, which may put them at greater risk of losing coverage for administrative reasons. Finally, states' eligibility processes will affect how smoothly the unwinding goes. Next slide, please. So what can you all do to help prepare for the unwinding and to support enrollees? So there are about 30 states that have integrated Medicaid and SNAP systems, which means the system that determines eligibility for Medicaid is also used for SNAP. For these states, you should determine whether the state is aligning SNAP and Medicaid renewals. This may mean that states push up a timeline for an individual's renewal for one or both of the programs, but it decreases the burden on states and minimizes enrollee confusion. Also, the timing of when states are beginning their unwinding process is critical. States can begin initiating renewals in February, March, or April, which for some states may coincide with the end of emergency SNAP allotments and other emergency flexibilities. As a result, states with integrated systems could see significant workload concerns, which brings me to my last point. For these states, monitor anything you are hearing or experiencing about workload concerns from the state. The more overloaded staff is, the more likely errors are to occur. Now, for all states, regardless of system integration, you should share any relevant communications materials that the state has available. So CCF has a 50-state tracker of unwinding documents and information, which includes communications materials and toolkits published by the state. And I'll link to the tracker once I finish my presentation. These communications toolkits include targeted materials for providers, health plans, and other stakeholders to use and amplify. It is important for stakeholders to use consistent messaging to reduce confusion among enrollees. The links to these toolkits can be found on the detailed version of our tracker, which can help you find resources for your state as needed. In a similar vein, you can highlight key information enrollees need to know about renewals, which I'll talk more about on the next slide. And collaboration with other stakeholders and partners to figure out what role you can play and how to coordinate a feedback loop for problems that you see will be critical. And finally, 15 states have adopted an E14 waiver, which I talked about earlier, to enroll and or renew individuals for Medicaid based on SNAP eligibility. States that adopt this strategy can help reduce work for both themselves, the state, and enrollees. Next slide, please. When working with clients, there are 3 key messages you should be sharing. The first, which is particularly critical before the unwinding process begins, is for enrollees to update their contact information. As I mentioned earlier, this will be huge in helping reduce disenrollments among individuals who are still eligible for Medicaid coverage. Once states begin to initiate renewals, enrollees should check their mail to see if they receive any correspondence from their state Medicaid agency. Importantly, not all enrollees will be renewed at the same time, and some may be renewed via ex parte. So we don't want to just tell everyone to look for a renewal form in the mail. Finally, for those that do receive a renewal form, they should fill out the form and return it quickly to the state to ensure that they maintain their Medicaid or CHIP coverage. Next slide, please. And so the last thing I will leave you with is to emphasize how important monitoring the unwinding will be, which is another place that you all can play a critical role. Identifying recurring problems or bottlenecks where the state may take action. Frontline organizations can share intel from the field and experiences with clients, which can be used to identify where problems are arising so that concerns can be addressed early. Based on this information, feedback should be shared with the state directly or advocates who can help connect with the state when corrective action is needed. And finally, if the state does not respond to issues arising, you can always highlight areas for national partners that may require CMS attention. And with that, I will turn it back over to Alex, I believe.
Thanks so much, Allie. So as Allie so compellingly showed us, there's going to be a perfect, albeit terrible storm where many families may be experiencing at the same time or very close in proximity, both the SNAP emergency allotment cuts and Medicaid unwinding. I think the SNAP advocates on this call can see a lot of the same churning that happens in SNAP that will happen in the unwinding among folks who are actually eligible for Medicaid, but they, for various procedural reasons, aren't able to get the paperwork in, or they never received it. So it's really incumbent on us, to the extent we can, to help families get information on what's going on in Medicaid. So one thing I would love for you all to do is to think about actions you can take to help families access Medicaid in the face of the program's unwinding. And some of you on this call do direct service and may already be doing not only SNAP enrollment, but also Medicaid enrollment. So there are lots of opportunities for you. But for folks who may be in the policy space or just doing SNAP enrollment, please think about things from Allie's remarks that you can do to support families. And then, one of the things I wanted to flag that we'll be sharing are all the state toolkits with specific messaging for families, stakeholders, and policymakers that Allie has lifted up. All right, so just think about ideas that you can do in the face of this. Interested in hearing what you're thinking so we can, amplify ideas with other advocates. And put any questions you have for Allie in the Q&A. I see one question already, and we will be returning to those questions at the end of the webinar. And if Allie wants to answer them in writing and then post it in the chat, we can do that as well. All right, well, now on to Pedro.
Thanks, Alex. Hey, everyone. First, just want to say thanks to Alex and the rest of the team at FRAC for inviting me to speak today. It's great to see everybody, and I'm excited to connect with you all. I think that the populations on the ground that we both work with, there's a lot of overlap and hopefully a lot of opportunity for collaboration. But first, I will just quickly introduce Economic Security Project, because I think perhaps not everyone has heard of us, and then I'll get into kind of two buckets around the state level work. One is places where tax credit expansions have already happened, and tax filers can take advantage of those tax credits right now in this tax filing season. And then the next is that there are a lot of ongoing efforts for continued expansions around earned income tax credits and child tax credits. So as I mentioned, my name is Pedro Morillas. I'm the State Campaigns Director for the Economic Security Project. I use he, him pronouns. We are an organization mostly focused on, not mostly, entirely focused on cash-based policies. So our goal in general is to put cash into people's pockets. And the way that mostly manifests itself both in our state and federal level advocacy is through expansions of the earned income tax credit and the child tax credit. I think most folks know what these are, but I just want to quickly do a level set just in case. So the EITC is a tax credit that was mostly designed for low and middle income folks who are working, but maybe don't make a ton of money. And this is a tax credit that's meant to reduce tax burdens and top up folks' salaries or wages across the board. And there's a federal earned income tax credit, which is where it all started. And then many states, I think around 30 at this point, have some state version of the federal earned income tax credit. The child tax credit, as you may guess, is specific to people with kids. And the idea there is to acknowledge that raising kids is expensive, and to give folks a tax credit that helps supplement those costs. The federal tax credit is by far the biggest. And then right now, there are 11 states that have a child tax credit, a state version of the child tax credit in place. But there are a dozen, possibly more states this round of legislative sessions in 2023 exploring creating a child tax credit. I'll get into that more toward the end of the presentation. But that I think is a big opportunity for both growth in the availability of the CTC, and also an opportunity for folks to take advantage of tax breaks in certain places around the country right now. Go to the next slide. So during the pandemic, really over the last 4 years or so, states have already been making expansions to their EITCs and CTCs. This is the list of states. I am happy to share these slides afterwards because I'm going to move through them quickly, but just wanted to put them all in one place. I'm going to go through now kind of state by state and the gist of what the tax credit is. And my hope is that, as I mentioned before, you all probably work with populations who could benefit from these tax credits. And there are groups on the ground that a big part of their effort, in addition to making these tax credits available in the first place, is doing the outreach to folks who are eligible to make sure that they don't leave this money on the table and they get the money. And so if you think that you have capacity in any of these states to help out with outreach and education about the eligibility of these tax credits, I'll put my email in the chat because I know lots of groups that would love to collaborate with boots on the ground in these places to get even more of these dollars into people's pockets. So I'll start from the top. We can go to the next slide. In California, I'm going to go through these quickly, but like I said, I'll share these tax credits or these slides afterwards. In California, there's the Young Child Tax Credit. So kids under 6. I think the big deal here is that the folks with no earnings can get this. So effectively, it's kind of like a guaranteed income for young kids in the state. Next slide. Colorado has done a ton of work around both the CTC and the EITC over the last few years, and they're both quite generous. I think among many highlights are the fact that in Colorado, folks who file taxes with an ITIN, so these are undocumented folks who don't file their taxes with a social security number, are eligible for these credits. That's also the case in California, by the way. So if you work with those populations, though, that is a big area for outreach and education. Next slide. In DC, also available to ITIN filers. I think the interesting thing about the DC credit is that this year it will also be available to be paid out monthly for taxpayers, which we saw with the expansion of the federal child tax credit during the pandemic, that monthly payments actually had a significant impact on how useful the money was instead of getting it in one lump sum. And it's worth noting that DC's EITC is one of the most generous in the country in terms of the amount that people can get. Next slide, please. New Jersey, also a version of the Young Child Tax Credit available to adults of all ages. Adults of all, it was just passed last year, and is fully refundable and does not have an income requirement as part of it. And then the state has also been doing a lot to expand its EITC. But since these are fairly new expansions, the outreach effort here is particularly important. Next slide, please. In Oregon, probably the big win that they've had is that their state EITC is available to ITIN filers, and they are now focused on a big outreach effort to make sure that as many of those folks who are eligible get it. So if you have folks on the ground there, a bunch of really great groups are doing outreach. Next slide. Utah. They just increased the amount that their EITC is worth. Now it's up to 15% of the credit. Not the most generous in the country, but I think Utah's both sort of a politically interesting place where we want to continue to make the case for cash. And I think driving demand for something like the earned income tax credit through outreach and education is particularly important from both just getting more money into people's pockets who can use the cash, but also demonstrating, even in a place like Utah, the value of these cash policies. Next slide, please. And then Vermont just last year passed a young child tax credit. I think I keep saying that these credits are available to folks with no income requirement. That in particular has some really big racial equity implications. Tax credits like these can sometimes be dependent on how much folks pay in income taxes. And as we all know, income taxes aren't the only tax burden that in particular low income people have to bear. And so this is these fully refundable tax credits with no income requirements do a lot to help level the playing fields and make the tax code a lot more fair for folks. But in Vermont in particular, since it's new, the outreach and education is particularly important. Next slide, please. And then in Washington State, kind of an interesting case, they don't actually have an income tax. And so they created something called a working families tax credit, which is effectively an earned income tax credit, but it goes down. It's one of the most generous in the country. This is the first year that taxpayers are able to take advantage of it. And it is it's unique in that it's harder to get the earned income tax credit to forego the income requirement. They haven't totally done it in Washington State. This one goes down to $1 of income. If someone has $1 of income, they're eligible for a minimum credit of at least $250. And so a lot of people are eligible, and we want to make sure as many of them get it as possible. Next slide, please. Hawaii. This has been sort of a long-term campaign for years. They've been kind of toying with the idea of expanding their EITC, and they finally have done it. In particular, the full refundability. I won't go into all, I think maybe folks know what full refundability means, but just to kind of, it essentially is that instead of just reducing your tax burden to zero, you can get money back from this, which it makes it much more generous for low income folks and makes the impacts among the most vulnerable demographics out there even bigger. And so a really important credit and feature of a credit that we want to make sure is getting taken advantage of. Next slide, please. Illinois also just last year did a big expansion of their earned income tax credit. The education and outreach is underway, and they are already pushing for even more in the form of a new child tax credit, which I'll get into in a couple minutes here. But I think this is, like I said before, both proving the case for the value of cash by putting money into people's pockets in a politically valuable place, and laying the groundwork for bigger pushes down the road. Next slide. New Mexico has been doing a lot of really great work on both the CTC and the EITC, making sure that this is a program that's taken advantage of by a lot of folks is important here in particular, because they're doing a really good job of making the case in general for unrestricted cash. They have hopes of getting to a place where they can pass state level guaranteed income policies. And these more familiar tax credits are the pathway that they see to get there. Also a strategy that the Economic Security Project is using to slowly move us toward a place where we can talk seriously about a guaranteed income. Next slide, please. All right. So I went through that very quickly. I'll just say again, happy to share the slide deck so that you can dig into it a little bit more, and then I'll post my email in the chat so folks can follow up if they are interested in any particular state or states. This is the list of places where I won't do the same thing. I don't have a slide for every single one of these states, but I'll just say that in general, these are the places where they are either looking to create new child tax credits or expand existing ones or expand existing earned income tax credits. And if we go to the next slide, this is sort of out in map form, which I think is just visually more interesting than a bulleted list. But the green states are expansion efforts where these credits already exist and the advocacy orgs on the ground are looking to make them bigger. And then the red ones are places where they are looking to create, in particular, child tax credits from scratch. We're involved directly in most of these places, meaning that we are funding campaigns on the ground in state legislatures to pass bills. And then indirectly with communications and policy support, as well as campaign strategy sometimes, but helping folks write bills and things. And I guess I will say that this is a pretty big sea change in terms of just how seriously states consider these tax credits, in particular the CTC. And this is our analysis of this is that it is in no small part because the federal government during the pandemic made a huge expansion to the child tax credit for 6 months in the American Rescue Plan. They effectively created a guaranteed income for kids in the country, and it reduced childhood poverty by around 40% overall. And while Congress kind of dropped the ball on making those expansions permanent, the states are picking it up and running with it for sure. And so, as you can see, also, this is not just a blue state thing. We sort of put our thumb on the scale in Nebraska and helped get the ball rolling on that child tax credit policy. But in Utah and in Montana, in particular, Republican governors proposed child tax credit expansions in their state budgets, kind of as a surprise to us. So it's a really interesting moment around both the interest and the capacity to take these tax credits on and expand them. The other, I think, just stars aligning feature of this moment is that most of these states are in pretty good budget pictures. They have pretty good budget pictures right now. And so these tax credits are just, they're still running into questions about cost, but in a less aggressive way, I guess, than normal. So we are very much in a place of we got to strike while the iron's hot and get these policies in as many places on the books, so that if and when we do end up in a different budget picture down the road, we're in a position of defending what's there as opposed to trying to create something new in a much less favorable budget environment. And so this is another situation where if you all have capacity in any of these states, our general analysis is that the thing that gets these policies over the finish line is bringing the people who can benefit from them into the conversation with legislators, so that it doesn't live only in tax committees or in behind the scenes, just sort of spreadsheets and numbers, but really that folks can talk about how an extra $250 would help them in their day-to-day lives in a way that just no, policy advocate could really replicate. So that's my general pitch to you all. Let me stop there so we can make sure we have enough time for questions. And I am happy to try and answer some that have popped up in the chat.
Great. Thank you, Pedro. This is really a breath of fresh air in terms of how deflated so many of us were on this call when we weren't able to get the expanded CTC and EITC in the end of the year legislation. We were able to get more than 550 anti-hunger organizations in every state across the country to sign on to a letter supporting that policy that, among other amazing attributes, reduced food insufficiency by 19%. So it's really emboldening to see that at the state level, there's so much action in terms of trying to expand these credits and put cash in the pockets of people struggling with hunger. So as Pedro mentioned, we're really interested in, collecting information from you all about opportunities to push for this in your states, getting people who, may be talking about losing $82 a month in SNAP benefits and using that to leverage the importance of getting some of this legislation to improve CTC and EITCs passed. So keep that in your bucket of tools to help mitigate the hunger cliff. And also, Pedro put out this call for you all. If you're interested in learning more about a state campaign, what state, again, we see a great opportunity to help support these campaigns for economic security. All right. Well, we're going to turn it over now to Sarah, who also has, some more positive news about how we can use some funding to really help struggling families and who are going to be even facing greater struggles when the emergency allotments end. So Sarah, please take it away.
Thanks so much. Sarah Beth Gale with the Southern Economic Advancement Project, or SEAP. I know I am the third speaker, the last speaker, so feel free to stand up and stretch, start chatting away, and we will move through this to the Q&A. Next slide. So the Southern Economic Advancement Project, we cover 12 southeastern states in the policy areas of economic security, climate, and health. And we really want to be a resource and a partner with groups on the ground. So we do research, capacity building, network building, and work on civic voice. And over the last 2 years, kind of our main push has been an equitable recovery from COVID-19. And so we've been working a lot on federal funds coming to communities and how those funds can be put into use for economic security in particular. Next slide. So the White House put out a report in 2022 that looks at a lot of indicators that show an equitable recovery and a lot of historic gains among populations around unemployment and income and health. And so we'd like to start off with this to note that there's a lot to be celebrated. Pedro was talking about the child tax credit. There's a number of really important pieces of legislation that happened during the recovery. And so there's a lot to be celebrated, but as everybody on this call knows, there's more work to be done. Next slide. So as of December, 35% of Americans who were late on rent or mortgage were fearing eviction. That's as high as 50% in places like Mississippi, West Virginia, and Florida. Next slide. Food insecurity in December, 20% in Mississippi, 15% in Georgia, and 16% in Kentucky. We focus on the South, so we talk about the South a lot, but these are not conditions just for the South. There's a lot of communities across the U.S. struggling with this. Next slide. And then symptoms of anxiety and depression, still 3 times as high as they were before the pandemic, and 4 of the 5 states with the highest were in the South. One thing that we're doing right now is running a community needs survey in 3 states. Just asking, what are your personal challenges? What are your community challenges? How would you like federal funds spent in your community? We did this last year at this time, and housing and utilities by far the #1 thing that folks were talking about. And these are SNAP households that we're asking the questions to. Right now, we're running it again in 3 states. Housing and utilities are still up there, but food security and mental health are really bubbling up to the top compared to last year. So we'll be running the survey for 2 months and reporting back what we're finding. We're just finding a lot of anxiety around food and mental health that we did not see at this time last year. Next slide. So the opportunity I want to talk about today is the American Rescue Plan state and local fiscal relief funds. So ARP was a giant relief package, a lot of money flowing to individuals, to businesses and nonprofits. But the ones that I'm going to talk about are the funds that flow directly to states and cities and counties and tribal governments across the nation, governments of every size, whether you are a town of 600 people or, the state of California, these funds flowed to every community. Next slide. So just real quick on the basics of the state and local fiscal relief funds, $350 billion. Again, it went to everywhere. Typically, these funds just come to states and large cities. But the kind of unique thing about this is that it hit every city and county in the country. Governments have until the end of 2024 to obligate the funds and the end of 2026 to spend the funds. So this was another unique thing, that there's a longer time horizon on these funds than there often are with other fiscal recovery funds. And then the uses are a lot more flexible than these recovery funds usually are. So you can use it for lost public sector revenue, premium pay, water, sewer, but the one that we're going to key in on is the second one, responding to the public health and negative economic impacts of the pandemic. So that's where food assistance fits in. And then finally, equity and engagement were really key features of this for the first time. And so wanting to know, how are these funds helping disproportionately impacted communities and qualified census tracts, and how local governments were reaching out to residents to hear about their needs and hear about their priorities for the funds. Next slide. So a lot of what we've been doing at SEEP since these funds became available in 2021 is talking about the process. How can you do equity goals? How can you measure racial and ethnic disparities and gaps and attack those gaps? How can we use this to really up the equity game throughout the city and county governments so that we can do this in budgeting processes normally? So we've got a lot of resources on our website about the process itself, but today I'm going to really hone in on the allocations and the outcomes and the programs that are happening around food. Next slide. So like I said, some of the funds went to states and some went to local governments. And so this image from the Center on Budget and Policy Priorities looks at the share of state appropriations from the state and local fiscal relief funds that have been going to food programs. So if you can read the tiny little number at the top that's kind of a lighter color, that's the actual dollar amounts that are going. So for example, 4% of ARP funds in the state of Delaware are going to food programs, 4% in the state of Washington, but those are very different dollar amounts. So in Delaware, that's $32 million. In the state of Washington, it's $157 million. So these are as of December, and they're already changing. So Nevada has already passed additional funds since this chart came out that's going to go to food programs. So this is something to continue to track and to continue to look at as these funds come out. I've included a lot of links to resources here. So I think these will come to y'all. And you can kind of go through there and it'll go state by state of how many funds came to the each state and how much funds are remaining. Next slide. So I'm going to talk about the local, but just to give some examples of the state as well. States are using things like setting up food banks with these dollars. Nevada has passed funds to do universal free meals in schools. So to continue that through the 2023-2024 school year. A lot of money going to nonprofits to help with food pantries, expand food storage. Congregate meals, home delivered meals. There's a wide variety of projects that are happening at the state level. There are some funds that are going directly to individual. I'm in Georgia. Here in Georgia, $1 billion went to one-time $350 card payments, not just a SNAP, but it included SNAP, Medicaid, and TANF. And so, there's state programs that are getting the funds, nonprofits that are getting the funds, and individuals themselves that are getting the funds. I put just a few examples of local communities that are supporting food programs with their share of local dollars. And so each city and each county is getting money. So for example, if you're here in Atlanta, it's not just Atlanta, it's not just Fulton County, it's every county in the region. Every single city in the region has their own pool of funds to decide with. So Jefferson County, for example, gave funds to nonprofits for meals and food deliveries. But Layton, Alabama, population of 632 people, also gave funds to nonprofits for food, clothing, and bill payments. So you often see this combined with other needs such as housing and utilities. I put the 2 Florida examples up here because they have meal programs, but also looking at small local farmers and local food systems and how to assist those local food systems, how to market them, and do some nutrition education as well. And then finally, Fairfax County, just put this up here to show they're including nonprofit organizations and then also houses of worship who are delivering meals to folks. Next slide. So the U.S. Department of Treasury has a dashboard. The link is there for when y'all get the slides. And so they're putting up projects that different communities are doing. So there's an expenditure category. I've circled it in red. You just go to that and put in household assistance food programs. And you can see what all is happening across the nation, or you can zero in on your state or your county and see what different projects are going. There is a lag in reporting. So for small places, they report every April. And then for larger jurisdictions and states, they're on a quarterly basis. So this April, we'll know a lot more information for smaller places, populations under 250,000, but still great to go on there, explore your area, see what's happening, or explore other areas to get examples of projects that you can take to your community and say, look at the things that other places are doing that we might want to replicate. Next slide. So the big question we get from advocates is there any money left in my community? Should I be out there advocating on this? How do I know if there's money left? So at the state level, the state pool of funds, there's about 13% of state funds left, or $25 billion as of December. So the Center on Budget is tracking this. Again, if you go to that link, it has a listing of who's at 100%, who has appropriated all of theirs, or who, like Nevada, is at 46%. One thing I would mention is even if folks have appropriated it or budgeted it, there's often still an opportunity to advocate, because sometimes they appropriate it for kind of a general purpose. And there's an opportunity to go in there and say, you know, I know you have $10 million for negative economic impacts on communities. Let me talk to you about food programs and how food programs can fit into that $10 million. So just because places are at 100%, it's often worth it to dig in a little bit deeper and see if there's still time to have a voice in it. Next slide. So we at SEEP released a revamped version of our local funds spending tracker this week. So there's a link at the bottom of that slide that y'all can go to when you get the slides. It's divided into those tiers that they do, with cities that are $250,000 population or above and cities below it. And so we have the projects there for each city and county. And this is not just for the South, by the way. We have all 50 states. And then we have a box that shows remaining funds that are unobligated as of April for smaller places and as of October for larger places. So we're going to continue to update this. We're going to get new data probably in the next 8 weeks for the larger places, and then April for smaller places. So go on there, explore, look at all the cities and counties around you and see if there's an opportunity to go talk to city councils and county commissioners about the needs in your community and the ways that they can use ARPA funds for food systems. Next slide. So we have an American Rescue Plan toolkit with a lot of information in it. The one thing that y'all might be most interested in is the activist guide. Talks about the basics of ARPA, talks about some organizing campaigns that have happened across the nation. It's not particular to food, the activist guide isn't. And then talks about, how to talk to your city council or your county commissioner about the needs of your community, because y'all are the experts in that. So how to bring your voice to the process. Next slide. So again, our website and ARP toolkit here, and also Pandemic to Prosperity. We work with Fair Count and the National Council on Citizenship to do a quarterly report that looks a lot of these indicators of kind of need around the nation. So encourage folks to visit that as well to help gather the data to make the case when you're talking to elected officials. Thanks so much.
Sarah, thank you so much. We're getting some interest in learning more about trying to access these funds. Such a compelling presentation and chock full of really helpful links and resources. All right, so I'm going to open it up for questions. Some folks have posted questions in the Q&A feature and they have been answered. But if anyone wants to ask a question, Steve, can we use the raise the hand feature if folks want to ask one verbally, as well as post them in the chat and then the Q&A?
We
feature?
could, yeah.
Okay.
Yeah.
I know it's Friday afternoon, so people may may not want to engage at that level, but
Yeah, we can do that.
yeah, while we wait for a question, I'm gonna ask a question of our panelists, which is like, what is, one concrete action someone who works primarily on the federal nutrition programs and policy could do to support making sure people access Medicaid, or a state EITC campaign, or making sure the American Rescue Plan funds are used in the best possible way. So why don't we kick it off with Allie? Just one idea that someone could implement.
Yeah, I think the biggest thing right now, and something that I think is fairly easy, is just anytime you contact, you're working with someone who you believe would be eligible for Medicaid or should have Medicaid, is one, making sure they're first enrolled, but also just hammering the message home to update contact information. I think that's the biggest thing we're hoping that people take away right now. We want to make sure that no one loses coverage unnecessarily. And even those who are no longer eligible for Medicaid, they can still get communications on how to transition to other sources of coverage. For kids, that's CHIP. For adults, it's mostly marketplace coverage. And so updating contact information and kind of making sure that any clients that you engage with know about what's coming is going to be really crucial.
Thanks. Pedro, one tip?
Sure. I think this one might be one that folks are already doing, but I'll say it anyway, which is that right now, one of the best resources on the ground in most states are VITA sites and free tax prep sites for a lot of these, in particular, new expanded tax credits. And so as you are connecting the folks that you work with these free tax prep sites, incentivizing them to or encouraging them to ask about, in particular, any EITC or CTC expansions. I'll say a bonus second one, which is that our vision for the world here is that the government should actually be doing a much better job of reaching out to the eligible populations for these CTCs and EITCs. And so if you are connected with the tax agencies in your state, encouraging them to do more direct outreach to the populations that you work with through letters or text messaging campaigns. We have a few examples from around the country where that's actually been really helpful in increasing the uptake for a lot of these tax credits.
Great, thanks. And we all have a request of you, which is for the VITA EITC sites to also promote enrollment in SNAP. We often have SNAP application assisters at these sites because the uptick in SNAP among low-income wage earners is there's always room for getting more people the SNAP benefits. So thanks. And Sarah, how about you?
Yeah, I mean, this is a pretty tight timeline and a pretty defined timeline. So all these governments have until the end of 2024 to make decisions. So really the time is now. And, we think that y'all have the expertise, and y'all have the stories and the data to take to these city councils, to take to these county commissions, and make the case that ARPA dollars need to go to families who are struggling with hunger. And so I would really encourage you, if it's not you, then maybe a board member, somebody who has a relationship with city and county officials, to reach out and ask to educate them. If the relationship doesn't exist, go to the city council meeting, go to the county commissioner meeting, and stand up and testify about what's happening in the community and how these ARPA dollars can be used to really help families in need.
Thanks so much, Sarah. And just to plug, when we're thinking about ways to support families in need, it's great. Many of the examples are right on. But, there could be possibilities to get funding for your 501c3 to help with application assistance and connecting people to benefits, as well as, money on an EBT card to help people get beyond the minimum wage, which is $23 a month. That's a strategy that could be helpful. I know you all have lots of great ideas. I hope this webinar gave you some new tools and resources and inspiration to move forward. We so appreciate you attending, and be on the lookout for the slide deck and the recording and any additional materials our presenters share. Thank you so much. To Sarah, Ali, and Pedro, really appreciate you spending the time with us, and thanks for your words of wisdom. Have a great rest of the week, everyone, and a happy weekend.